This has been The Real Housewives of Tesla STEM with Meg Stockbridge, Janae Shuffles, and Arnie Leslie. Tune in next week to find... This is a public service announcement on the recent E. coli outbreak. I'm Counter Rayford, and you're watching Blooper News. E. coli was first recognized as a pathogen in 1982 during an outbreak investigation of hemorrhagic colitis. It was not until 1993, after a large multi-state E. coli breakout in the U.S., linked to undercooked beef, that it became broadly recognized as an important and threatening pathogen. It all started when a Chipotle employee failed to properly cook raw meat meant to be put into the food served to customers. E. coli bacteria can be shed into human and animal feces, which in turn can contaminate food, water, and various surfaces. A person becomes infected when the bacteria enters through the mouth and into their body. Here, the Chipotle employee didn't have gloves on, and the bacteria from the meat transferred onto their hands. If they put their hands in their mouth or touch something they are about to eat without properly washing their hands before, they can become infected. When proper hand-washing techniques aren't used after handling raw meat, the bacteria from the person's hands can be transferred onto any surface they touch. Any person who touches these surfaces afterwards is at risk for being infected. The burrito prepared was infected with the E. coli virus, so when this customer sat down to eat it, they became infected with the bacteria when the undercooked meat entered their mouth.
Anyone can get E. coli. However, younger children, older adults, and those with weakened immune systems such as HIV/AIDS patients are more susceptible.
Infection and exposure to pathogens may induce initiation and intensify autoimmune diseases. Symptoms can vary from person to person, but the common ones to look out for include vomiting, diarrhea, fever, chills, and severe stomach cramps. On a scale of 1 to 10, how severe are your cramps right now? Thank you for your time. In severe cases, patients can develop pus, a condition that affects the blood and blood vessels. It results in the destruction of blood platelets, anemia, and kidney failure due to the damage done to tiny blood vessels in the kidney. Symptoms can start to appear anywhere from 1 to 10 days after exposure. Typically, they will start to appear after 3 to 4 days, and most patients will recover within 10 days. In order to diagnose this disease, a doctor will send the patient's stool sample to a special lab where a clearly certified medical laboratory scientist will test for the presence of E. coli bacteria. The bacteria may also be artificially grown to confirm the diagnosis and identify specific toxins. E. coli is fairly easy to diagnose because it is simple to grow in laboratories. It grows anaerobically and under ideal conditions. Individual cells can double every 20 minutes. In normal cases, there aren't any visual symptoms that are used to diagnose. However, in very severe cases in younger children, they can start to have reddened skin after being infected. Taking antibiotics is not recommended as they can increase the risk of further complications. Antidiarrheal medicine should also be avoided as it can slow down the digestive system, preventing your body from getting rid of the toxins. Those experiencing diarrhea should stay at home and rest, as well as drink plenty of fluids. The CDC estimates that 265,000 stec, sugar toxin-producing E. coli, which is also the most common type of E. coli, infections occur each year in the United States. E. coli O157H7 causes more than 36% of these infections. E. coli is not a life-threatening disease. However, as mentioned before, in very severe cases, the patient can develop pus. This can occur in up to 10% of patients, 25% of which may experience neurological complications such as seizures, strokes, and a coma. The case fatality rate ranges from 3 to 5%. There is no set treatment plan for E. coli. However, in severe cases, kidney dialysis may be necessary. The surgical procedure should not be needed. Some conditions, such as gallstones, require surgical procedures in order for the patient to recover. However, this is not the case with E. coli, as rest and liquids should help the patient heal. This disease is capable of reaching an epidemic level. However, on the pandemic scale, it has only reached the level of sustained human-to-human transmission, leading to community-level outbreaks. This epidemic is not the first, and outbreaks have occurred due to sources other than raw meat. This map shows one of the latest breakouts due to contaminated lettuce. This epidemic has shown to be widespread mainly in regions of California, Colorado, Wisconsin, and Pennsylvania. Currently, there is no designated vaccine to prevent E. coli, but researchers are continuing to look for possible solutions but have yet to find one. Here at Blooper News, we want everyone to stay as safe as possible. Some precautions you should take include making sure your meat is always cooked to the appropriate temperature, washing your hands and any surfaces you touch thoroughly after handling raw meat, keep any raw meat separate from any other foods, and never drinking milk products that have not been pasteurized. Thank you for listening, and back to your regularly scheduled program. Tune in next week to find out what Arnie Leslie has to say about the other housewives.